All right, thank you. I'll start again. I'll call this meeting to order for Health and Human Services on Thursday, June 4th at 5 o'clock. Roll call, please.
Kay Wilson.
Here.
Jim Miller. John Minto. Chuck Van Etten. Jeff Haney. Lorraine Gouget. Dawn Pettit. Pam Mueller. Dr. Dunlap. She's excused. She'll be joining us later. You have a quorum.
Thank you. Let's do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Liz, do we have certification of compliance with the open meetings law?
This meeting was noticed to the media and public as required by Section 19.84 of Wisconsin statutes.
Thank you. We have an agenda. Any changes?
Yes, I just want to make a note that when we get to the truancy and diversion report, we are going to report on that next month due to some issues today.
She's not going to present that report?
Not today.
Okay, thank you. Public comments. Linda?
Linda Zilmer, Edgewater property owner, and I appreciate the change in the schedule. This committee, what it does is very important, and I've not been able to follow it. And so the comments I have tonight are more forward-looking and maybe asking that as you look at your 2027 budget and you work on that, you also incorporate a little bit of what would have been done under strategic planning if that had been a more complete process. One of the things I'd like to ask for 2027 is that all the well water testing that the county's been doing for years, I don't think that that's been analyzed or mapped. And the county has budgeted for working with LCO and natural geologic, whatever that is, on the groundwater flow mapping. And I think the water quality mapping would go along well with that. I have a couple of emails to send out. Washburn County is helping facilitate some well water testing in July. And in the Driftless area, the Crawford Stewardship Project has been working for years with the 3 counties down there on well water testing. With regard to one of the strategic plan goals that you have, actually crosses a couple of them, is UW Extension has a lot of resources that help people maybe even before they're in need, whether it's on mental health or budgeting or planning for aging and death. There's just an abundance of things, and the UW Extension Committee focuses more on economic development and not that much on extension. And I think a lot of the things that HHS does could benefit from working more closely with them. That also, in neighboring counties, extensions, they have natural resources coordinators, and they have also done more with food share. With the federal dollars going away from food share, most other counties I know made sure that they preserved a position. And I see that you have a report that says that for the northern area that looks like there hasn't been a problem, but I'm not sure how Sawyer County will handle that going forward and if the error rate will continue to stay 0 or none at all. Sorry, my phone does not wake up anymore. Even for things like, I see one of the goals or one of the things that you have listed under your strategic planning is housing. UW Extension does a lot with community development, and I think public health is more within your realm than focusing on housing, although that I know is a need. But I think you could get resources available where it doesn't fall so much onto you. And then finally, when the code enforcement officer position was created under a prior county administrator, that position reports to administration. And the monthly reports given at Public Safety are more about animal control. And there's really no detail on the code enforcement that they're doing either for HHS, for things like tourist rooming house, or under zoning. So for the 2027 budget, please see if that is a better fit here or in zoning, or at least that you get the reports. Thank you.
Thank you, Linda. Let's move on to number 8. Oh, is there anyone else? Anyone online? Okay. We'll move on to consider approval of the minutes from our meeting in May.
Before you make a motion, I left Mike Markren off. He was here, present, so I would like to amend those to add Mike Markren to the others present list.
Thank
If
you.
that's okay.
Is there an approval for the amended minutes? Second?
I'll second.
Motion's been made and seconded to approve the amended minutes as presented by Liz. All in favor? Aye. Opposed? So carried. Bylaws.
Well, we had talked last month about possibly making some changes within the bylaws. I did go over the bylaws and compared those to the statutes, 251 and 46. Much of the language needs to stay the same within the bylaws, and I also understand that maybe we should wait for some potential changes at the county level, and then maybe bring it back next month and take a look at that.
I reviewed the bylaws, and there were a couple of things that I wanted to bring up, though.
Okay.
Under composition, 1A, it says an individual who receives or has received human services or shall be a family member of an individual shall be a citizen at large. We don't have that person.
Yeah, we do, Pam. And Dawn.
They have received human services?
Or have family members who have received human services.
Great, thank you. Okay, that answers that. All right,
And it is in statute. That's why it's written in there that way.
okay. And then a board member can serve a term for 3 years.
That is in statute. I
Yes.
was looking at that thinking, it seems, a little counterintuitive to the way we kind of do the board coming on and off every 2 years, but the term is actually every 3 years. So we're going to have to just figure out how to do
It says
that.
it's not limited to the
It's
board
not
members,
limited.
But I'm thinking of our other members.
Yep, and we have those kind of mapped out on timing as well.
Okay, all right.
We have to be better at that, and that's one thing that I started working on.
Then it came to Article 4, meetings of the board. Meetings shall be held monthly, and the agenda is the responsibility of the board chair. I have not done anything like that. I've always turned it to you for the agenda, and
We could maybe, and I don't know if any of this language is potentially going to change, but maybe it could be that the board chair and the director work together on it, because we always include you on for
Yes.
anything else that you might want to add.
because I'm very negligent in that area, and
Liz,
Can I just say, I think that that's a statute in the sense that any chair is the person where the buck stops with that person. So you're actually approving the agenda for publication, which means that we've all worked together and your name's the one on it instead of Julia is basically it. So we also have finance where Randy provides a lot of the reports and content. So the person who's the chair is just saying yes after Randy is done with all her reports. So I mean, I guess I count on Julia to provide content, but then we run it by you for the final approval. Does that sound right, Jim? You're nodding?
Yeah.
I think that's rules of order
Yeah,
for that.
It sounds like they'll compile the info for
Like-
your approval. But you have to put your.
okay, should I respond that I approve so that it is on record that I have approved the agenda?
Yeah, yeah, that would be great. There's a few chairs who just I don't hear from them, but then we also have Mike CC down there, so we have a lot of eyes on it, especially when the content's coming from someone, we know it's complete.
Right,
Yeah, but yeah, that would be great if you would respond.
okay, all right. then that will be answered by the board later. That's what I had. Okay, great. Anybody else have anything that they want to bring up? All right.
Okay, then we'll wait to see what comes forward, and then Mike and I said that we'd try to connect before the next meeting. Maybe we can have a rough draft at least put in, so then we don't really have to talk about it. You can see what the language could potentially look like.
Right, I think one of the questions that we had was voting and
And in person.
in person, right. All right. So Lorraine isn't here, so do we have anything from LCO reported? All right. Anything from the Senior Resource Center? I saw a report.
Yeah, this is our board report that Joey Johnson gave to the Senior Resource Center Board. So it's kind of internal business, but I didn't hear from Joey, so I just put this on here. They're looking at changing bookkeepers this year, so Lynn Fitch is considering doing that, and she's been getting some training on that. But that's about it. There's a lot of fundraisers this summer. They're working on a lot of fundraisers.
Anybody have any questions on the Senior Resource Center? All right. Let's move on to administration.
Okay, so the org chart, there are changes again from this that's not on here. So I'm just going to it'll be part of my update and the org chart and a little bit with the strategic plan. So just to kind of go over a few things, Carol Martin has officially retired, and when we get to the ADRC long-term care, I will introduce the new supervisor. The dementia care specialist has left, and we will be interviewing next week. So hopefully we'll be able to hire out of those candidates. That's in the ADRC long-term care updates. Moving into the business services division, Brittany Carroll did put in her resignation, and her last day was yesterday. So we are in the process of interviewing for that position, or seeking applicants at this point. We have not scheduled the interviews. Other areas, Tanya Richards has officially started in the ES position. She's transferred from the business services, and Allison has left. And then I think those are our main updates as far as what's on there right now. So lots of work also happening in looking at some staffing, and I'll kind of talk through some of those things as we move through. In fact, Haley, I haven't had a chance to talk to you, but you'll be happy to hear some of the results. I think that's it on that section. Thinking about the other update that we have is we had our all-staff day. That was the day after our last board meeting. That went really well. In person, we did that at the Wesleyan Church. It was a fairly laid-back day. We were trying to get all our staff members to engage with one another, collaborate, share information, laugh a little bit, play some outdoor games during lunch, all those types of things. We did a lot of sharing on what every individual division is working on, what their priorities are, how you can engage in those services. Heard a lot of great feedback on being able to have that whole day instead of trying to kind of squeeze in some work and then kind of jump into a learning session. It worked really nice to have that full day. So we would look forward to be able to do that annually, which would go in conjunction, it would give us 2 annual days, one with the county and one with our staff. And then when it comes to some of the little smaller things that we need to work on, we'll kind of do those. We talked more about maybe having some webinars that people could jump on, like I could do a Zoom and record it and get the information out and do it that way periodically throughout the year. So I'm very happy with that. Thank you very much for allowing us to do that. Strategically, obviously, that is one of our big things, is that connectedness with our staff. The other areas in the strategic things that we've been working on. We had just a shorter period of time between our last meeting and this meeting, so not a whole lot to report on. But we are, one of the big things is to get staffed up at transitions to be able to transfer that high cost client, and had great interviews. I have a few more interviews tomorrow. Hopefully we'll be fully hired up in June and being able to bring that client back. And then a couple of things that Carrie's been working on is really kind of streamlining, making sure that we're getting away from our old habits of having written charts and written things, and really at our, using our electronic record and not duplicating things. So she has just had a few meetings this week that I think we've caught some old habits, and hopefully that will kind of eliminate some work and streamline the processes. Those are kind of the big highlights for admin right now. Any questions for me?
I had a question about the strategic planning. Under county goals, affordable workforce housing, that's blank.
That's a county goal, not a,
Each department doesn't have to have a goal within each county goal. I asked them to pick 2 or 3 goals that would align.
maybe I shouldn't put those first pages in, maybe it's confusing.
But Health and Human Services does have a influence on that.
Well,
area.
our goal was not to pick things that were unachievable and not be able to get any of it done. So when Mike and I talked, it was really kind of like, what things can we realistically work on and get done without muddying the waters on the strategic. Now, if we're looking 5 years out, maybe there is a different kind of a plan, but originally to get started with the strategic plan, it was in this year, what are the accomplishments that you want to try to achieve? And we bit off some pretty big things even with what we chose.
Right.
So I'm not sure where we want to go with housing. If that's something that you feel like going into 27, we need to be focused in on, that's what this board is for, is to kind of drive that policy.
And I also noticed that mental health, who is responsible for that strategic plan other than HHS?
We actually do quite a bit with our community health assessment, and that is something that we're working on as a community. So there are, between the hospital and the health department, really co-connecting on that, and then pulling all the different mental health providers and creating some of those goals throughout there.
So
So it's
actually-
kind of happening on that side of things, not really being driven directly by administratively, like right inside our department.
So it's actually not blank, it's just,
Well, we could, maybe there's a way that we could rewrite that to say, here's what's happening. I don't have how do I say that? Where I don't have direct authority over that. That is a community working together at that. So we could just say, as a side, these things are happening.
I know, because we do have a mental health report. I mean, that's part of the reports that we get.
Right. Yeah, I can.
Did you have something to say, Mike?
I do want to add something. So I did ask department heads to pick 3 things to focus on that they had direct control over and impact on, and limit it to 3 so that it wasn't overwhelming. And especially the first year we're doing something like this.
Okay.
To keep it where it was manageable for department heads and staff to experience some success, have impact, but experience success, not get frustrated because they, had 2 goals in each of the 5 categories. That would be a lot.
Well, and actually, maybe I could have because CCS and working on that and growing that program is a mental health program. So it's just not in that capacity. It actually fits in a couple sections, so.
It's not that departments aren't doing anything beyond the strategic plan. I just asked them to pick 3 to really focus on and report back on. So yes, we're doing a lot with mental health, and housing is a tougher one. It's such a need in the county. We don't have a lot we can do directly to impact it. You know, it's more of a municipality that can control that through TIDs and things like that. We can't do that part as a county, but we want to support what we can. And there are potentially some areas that zoning, Jay has mentioned a few times, that there are things we could do to encourage some development. So,
I mean, yeah, on the affordable workforce housing, I really, as Mike said, I think that's more of the subset of zoning or economic development. In terms of housing in HHS, I could see the role being, whether it be like dealing with radon or carbon monoxide or lead paint, things of that nature, or accessibility, certainly for our seniors, helping if we have housing stock that needs to be converted over for people for accessibility issues. That could be maybe the role of HHS, but just to say affordable housing, I don't know that that's a subset of HHS necessarily. So,
I think homelessness was included in part of that, so.
yeah.
Yep, and that would probably be more of an area that we could have some impact in.
Right.
Yeah.
Okay, I just had questions of,
And this is good because this, again, it drives where we would be going as we think, because we're going to start thinking about budgeting and, well, we are starting to thinking about budgeting and planning going into '27. And if it's the priority of the board for us to really like hone in a specific area, you know, we want to hear that. Okay.
do you have anything else under administration that you'd like to discuss?
No, I think everything else will just hit along the way.
Okay. Let's move on to aging and disability resources.
Okay, like I said, we've had our transition, and we have that opening of the dementia care specialist / INA. So those interviews will be happening. But Ashley Miller, our new supervisor and ADRC of the North Branch manager, is here. Ashley, do you want to just step up? You have to step up to the microphone and introduce yourself and maybe just give a little quick synopsis.
Okay. Hi, my name is Ashley Miller. I'm the new supervisor for the ADRC, ALTC.
Yep.
I'm learning all the acronyms still. It's my
Good
first.
luck.
Yeah, and we're doing the best we can not to use acronyms, so you're good to go.
It's my first week here, but I am a certified social worker with the state of Wisconsin. I actually worked for Sawyer County many years ago as a CPS worker. So then I transitioned to the hospital where I worked there as a social worker, and now I'm here. I live in Hayward. I'm a mom of 2 that keep me very busy. But yeah, that's my little synopsis.
So we're very happy to have Ashley on board. She was able to work with Carol for about a week to get transitioned. She's already met with the ADRC of the North Regional Director, and we're interviewing. She's got her interview set up for the dementia care specialist, and we're going to keep plugging away. So welcome, Ashley.
Thank you.
Behavioral health.
Okay, I know Alicia is not able to be on tonight. I know we made this change to make it easier for all our staff to be here, but other things were planned before this got changed. So I expect there to be better attendance in the future. I think the report kind of speaks for itself. I don't know that anything new is coming about that I need to speak on. Except for, I'm not sure if it actually says this, but Allison is completely finished all of her work that she needs to do with the CCS program. And so that's exciting that we'll have a facilitator now. And we were able to transition that from within.
Is Joe up to speed now for billing?
They still have not fully credentialed him. He is doing OWI assessments, which he does not need to be credentialed for. So when he comes in and he's doing those assessments, we're getting paid on that side of it things. So we haven't started
Taken a
doing
long
client. It's taken longer than I expected it to take. However, as I've looked at it, it does take a long time, and we just have to wait for those credentials to come through. So.
Because of the state, huh?
Yeah. Okay.
Community support and mobile crisis.
Caitlin, do you want to step up? She's actually here, so I'm going to just let her speak to this. Not actually here, she is here.
Person, yes. I don't think I have much to add to the written report. We stayed pretty steadily busy during that month for mobile crisis. And then our community support program has maintained pretty steady as well. As far as, we've had mid-40s for consumers in that program. We did get one new individual in April. Nobody discharged in that month. And only 10 of those folks were on a court order to be in the program. The rest were all voluntarily engaging.
I have a question. What is your maximum, what's your cap for CSP program? Have you ever,
The state does have a ratio, and I don't want to misquote it. I think it's like 20 consumers.
That's what I was
per
gonna say.
case Manager,
Okay.
per full-time case manager. I think with our current amount of consumers, that is plenty, given the needs of some of those folks. We have some that, we have one individual we see every single day of the week, and quite a few others that we see multiple times during the week for, at least an hour at a time. So I would say we're pretty max, able to do it comfortably so far. But
it's a great program. I have to tell you from the other side, it helps a lot keeping folks out of the ER and out of the hospital, so.
that's the goal. So thank you for that feedback.
Yeah, they do a good job too of, we were able to use a crisis bed. So instead of waiting for them to full-blown have issues, we're able to kind of do it's almost like a respite crisis to get them to get a little bit more support in Ashland, and then get them back. Usually it's for a few days, but it's nice to be able to have that extension as well.
Yeah, and we're lucky too with our current psychiatrist for the program. He oversees the whole program, and he's very flexible with us. So if one of the clients is having a rougher time or needing an adjustment with their medication, they're not having to, like a traditional clinic setting where you'd schedule an appointment and maybe it's 3 weeks away. He's more readily available to help in those urgent situations, so.
So as a board for advocacy, this is something that we want to be able to advocate with the legislature on, to be able to have this be a fully funded program as well. Because what we're able to do with CSP with these daily visits, monitoring the medications and those kinds of things, we can't do that with CCS. So, it's a niche on both sides. And it would be great if we can get that to be at 100% fully funded as well.
What is it funded now?
It's at 40, yeah, 60/40, thank you. I was like, oh, I'm going to say it wrong too. He's got the numbers.
Yeah.
Yeah. So, and we do get funding back on WIMCR side, but it's not the full amount like what we do with CCS. They make us completely whole on CCS.
What do you do to try to get it to 100%?
There isn't anything you can do.
There's not.
Well, advocacy with the legislature to change that.
Who do
So
you contact?
your legislature,
You do that?
you do. I can't lobby.
You do that?
We should be doing that.
We can do a
as-
resolution
We
as a
should do
board.
that as a and I think we did do a resolution last year. We also work with WICSA and WCA on these things as well. But yes, resolutions from every county also is impactful.
Well, should we think about writing something up?
We could do that. We could look back at what we had, because I'm pretty sure we had a resolution in the last budget go-around.
Well, it would be important to emphasize it every year. So you're going to do that, Mike? You're going to check on that? Thank you very much. Thank you, Caitlin, for your dedication.
Thank you.
The other reports are the monthly expense report and the cost by client. Nothing outstanding there. I'm excited for when that cost by client will start to transition.
Although I saw that Winnebago is already over It's projected
Winneb-
annual.
Winnebago is over, but Limitless is at 0. So that client that used to be in Limitless, when we budgeted, so it might not be showing up on that with the projections the way she has it, but in the budget, we budgeted dollars for Limitless. The client is in Winnebago. It's happening in a different area, but it's budgeted.
Okay. So that's kind of a.
It's
skewed
a
number.
wash.
Okay.
But we do need to get that transitioned so that, because it won't be a wash much longer if I don't get that move done.
And then client C moved out of the county.
Yes.
Do we,
Maybe I should just take that client off of there.
we're not responsible
Nope,
anymore? Okay. Thank you.
I will work on that. We've been kind of, fiscal has been very, very busy right now, so trying to get all the budget, everything ready for us to be able to start looking at so that we can start making some decisions. So as we work through that, we'll get that cleaned up, make that look a little better.
All right, let's move on to Child, Youth, and Family Services.
Okay, so I just have a verbal report on Child Protective Services, which is a couple of good things that have just happened recently. So there is, for Indian children that we have placed, that that ICW, so Indian Child Welfare, that they place, we're responsible for the cost of that placement. However, at the end of the year, at least for the last couple of years, the state has what they call a high-cost pool, and they have so much money set aside for that high-cost pool. And then we're able to apply for assistance. So basically try to get money back from some of those placements that we had. And so Tabissum, who is the director at ICW, makes that request. We pull those reports together, we turn that in and sign off. Anyways, this year we happen to have received 110 back, 110,000. And so it took me $110, 110,000, which will be going right back into the Children and Family Services. And so that wasn't budgeted. So that just gives us a little extra to kind of offset, because we always spend more than what's been given, that we get allocated. So that'll just be a nice little bump in there. Another thing that we have found out on is that we also will be getting additional $28,000 to help with youth and families in trying to maintain them in their home environment and keeping them from needing to go into foster care or out-of-home placement. So we talked today as a team on how we would potentially be able to use those supports along the way. So a couple of good things, not budgeted, but funding that's coming back in to help our budget. So positive things there. Otherwise, things are going pretty good on the CPS side, and things seem to be going really well with connecting with ICW. I think the relationship is going really well there. That's the CPS report. Child Protective Services. See, now I went back into using acronyms.
And let's talk about youth justice.
Okay, Youth Justice Report is on here. Sarah was unable to attend today, so the report is her normal report. And Melinda was going to attend to do the diversion report and kind of do that year synopsis. We will do that next month. We actually, I just want to give kudos to our team. We were having a staff meeting and Melinda received a call that we needed to take 2 kids into custody. Worked really well with law enforcement, got the information she needed, found out that we really were going to have to take them into custody. The team pulled together and we had to find placement. Eau Claire and Marathon could not accept anybody, so we needed to find beds. We also had to do temporary placement order, which then they have to go to court on and have everything ready by 10:30 tomorrow morning. Anyways, the team pulled it all together, and I think Melinda was reading rights and doing what she needs to be doing over at the jail. But I'm proud of the team. Sarah wasn't there, and that whole team worked together to make it happen in a short amount of time, so. They're doing great. Does anybody have any questions for me? I know we love to hear about the fact that we had to place somebody in JEC, but we'll find out what happens after that.
Can we move on to economic support then?
Nope, we can't. We have to wait for Children's Support Services, and Haley is here.
Oh, I'm sorry. I thought what you just said was part of
Yep.
that. All right. Thank you.
So nothing new to add to the report. I do want to highlight, though, that results of the state annual data review reflected compliance with no corrections needed. So this is just one of our 2 state reviews, and it's really just looking at compliance with information that we're adding into PPS. So that's information such as timelines for evaluations, service start dates, IFSPs, transitions, and referrals, things like that. And then in CLTS, we are at currently 60 participants, and then 2 children that they screened eligible on the functional screen. So then you'll see them reflected in the numbers for May.
And so the good news is we are strapped and at capacity. And so we left Haley's position open to see what things would look like. We are going to be posting and filling that position. So that will help for Haley to actually be a supervisor and not working boots on the ground and helping with birth to 3. So she's there on birth to 3, she's hearing everything, but there's no capacity to pick up some of those pieces that Lisa Nasser left open when Lisa left, so. She was off today, I was like, I haven't had a chance to talk to her, so, thank you. Anybody have any questions for her? Anything? The good thing about Children's Long-Term Support Waiver Program is that is a fully funded program. So the state encourages us to make sure that we're at full capacity on our staffing because we do get full reimbursement on that one.
All
Okay.
right. Now we can move on to economic support.
Economic,
Is Shauna here?
Shauna is not here.
I'm here.
Oh, you are here. Oh, I thought you weren't going to be here. Shauna's here. Okay, go ahead, Shauna.
Not too much has changed over the month of April. That's what this report is here as far as our benefits issued and caseload have stayed pretty consistent. Of course, with it being May now and school ending, our childcare cases, they take special attention during the transition from school being out, and then again, usually in August, September. So our childcare team is quite busy right now. Things are holding pretty steady with food share and our Medicaid programs. We also wrapped up the regular energy assistance season. Very successful here locally. We were above the applications that we processed in the 24-25 season. So we finished very strong there. And then new this month is I enclosed the error report and our guest from before our meeting started had brought up the error rate. And I don't know that we've gone into a lot of detail about the food share error rate and our responsibility in keeping that error rate low. Proud to report that for this period, the Northern Consortium, the cases that were pulled for review, 0 were found in error, resulting in a 0% error rate, of course. So that was very good for Northern, very proud of that work and the things that we have already put into place to ensure that our cases are accurate. So we have the lead worker team that helps in looking at work. We do 2 quality assurance reviews for every IM worker monthly. We also do what is called a PCR review. So what it is the CARES Worker Web program has a system that we can use to pull certain criteria of a case and look at the types of things that result in error on our cases. And a lot of times that's computation errors. Anyone who's ever worked in a computer format where you're pulling drop-down boxes knows how, if you're not careful, it can be easy to choose something wrong on a drop-down box. For instance, if we were looking at calculating earned income for a household, there's, weekly pay stubs, bi-monthly, semi-monthly pay stubs, and it's of course important to choose the right drop-down choice. And very important that we have good critical thinking with our workers so that they, as they're working the case, have an idea of what that budget should look like for eligibility, and then to, before confirming benefits, really take their time to review, in this case, the food share budget, because this error rate is only looking at the food share errors, and the federal government has imposed that states have low error rates, and there could be repercussions placed on the state if our error rate is high. So I thought this is something that is definitely out in the media. It is, we've received additional funds coming up to ensure that our cases are accurate and we can keep this error rate low. So, and this is hot off the press. I didn't have time, of course, to add this to any reports. So Julia, and maybe you can talk more about this, but there was a meeting with the consortium directors about creating a quality assurance team, lead, and a supervisor for this small unit to look at these reviews. And 7 out of our 11 counties stepped up and said that we would have the capacity to do something. And so we surveyed workers, and Kim Christensen here at Sawyer County showed interest and also was reviewed and selected for one of those positions. Down the road, we will be also hiring one lead position. Not sure, what the criteria exactly will be, because we're kind of building this team from the ground up. She has also expressed maybe some interest in that lead position. I think she would be a great candidate. She's been with us doing this work for 10 years. So I'm hopeful for her opportunities. And then we will also be looking at filling this vacant position by Kim here in our, local agency. So that's the big news. We're coming off of a management evaluation review, which was very good. We continue to have great customer service. If you go back up to the report prior to this, the monthly report that I have, it again highlights our timeliness. Our answer rate is at 96%. I know the longest wait time in April was 39 minutes, which does seem like a long time to be on hold, but it sure beats the southern part of the state where you may be on the phone for half the day. So, any questions?
I can speak a little bit more about the positions and how that is working. So we received funding from the state, and we have to have a plan in place on how we would use that from a consortia. We will have 5 positions plus a lead worker, so 6 positions can be fully funded, and that funding, it will be going forward. We're still responsible, even though Kim is going to be moving into that position. We are responsible from Sawyer County to have so many workers. Each county has so many workers within the consortia based on our population size. So Wood County has a ton of workers. We don't have as many, but that is something that will need to be backfilled. Out of the we're hiring 6 to start off with, 6 QA that are coming out from the group that's already there. We're hoping that we'll kind of stagger through because and one of the things that we'll be doing is the workers will continue to be doing some of the call center work and some of the work they're already doing, plus some of the QA work. And we want to stagger that through because you don't want to lose all your people that were really good and then your error rate goes up. So we're going to be really careful with that and have a plan going forward. Then once we're up and running for a little while with our 6 workers, out of those 6 workers, they'll have an opportunity to apply for the lead position. So as Shauna was alluding to, we're hopeful that Kim can be a candidate for that. We'd like to see her be able to be promoted. So this QA position is a lateral move. It is just an opportunity to be able to do something different within the consortia. And not everybody would enjoy doing QA work. They'll have quotas of reviewing, I believe it's 25% of all cases. So we need to ensure that our error rate stays low. So that is what we have on that. Questions?
What does QA stand for?
Quality assurance.
All right.
Thank you. We gotta keep doing that. The final report that I have in here is a report that we've put in quarterly. I had missed putting it in the previous month. Just looking at, and this one just outlines what is happening with child certification. As we know, we can always use more childcare facilities. So anybody who might be interested in doing childcare, we should all be referring them to Northwest Connections. They will help them get up and started. And so, yep, so that kind of speaks kind of to the error rate that we talked about at the beginning.
So there were no people from Sawyer County that attended these meetings?
What meetings?
That January,
Oh.
March? That's, okay.
That does, it could be, when you look at that, that's kind of trainings. They could already have had all their trainings in too. So we don't have a whole lot of providers in the area. And if at some point you would like, we can have Northwest Connections come and speak to that, which might be very interesting for you to hear about what's happening with daycare in Sawyer County.
I mean, and actually, if you think about workforce development, not having good childcare, and I hear about this all the time, like people are on 6-month waiting lists. People move here to get a job and they don't have childcare. I don't know if that's something that we can help with underneath the workforce and housing.
Probably a good thing.
I can speak a little bit more on the childcare. So there's, like you're saying, there's a huge need for childcare, and I think what most people are using are, sometimes the non-certified daycares or family members. There are programs available for family members to get assistance, and I think that those programs used to have a little bit more success, but now the training that people have to go and take is a deterrent. It's all very good training, but sometimes people look at that as being too intrusive, unfortunately, and so definitely the number in certified childcare providers has gone down. So I think it would be, it's very interesting. I think the more education we can get from Northwest Family Connections is great. They do a simply wonderful job getting out into our schools and getting the information put out there. Unfortunately, we're just not getting people interested in setting up daycare.
Thanks, Shauna.
Anything else under that report? Otherwise, we'll move on to public health, and I think you said Julie was online.
Yep, Julie is online.
Just wanted to highlight our respiratory rates are low in addition to being low in our region and our state. Not uncommon this time of year, but we did see those go down a bit. We are seeing increased reports for tick-borne illness. Also not unexpected during this time of year, although we have had more cases of EM rash, but I believe it's probably likely due to how they're reporting now through the electronic medical record, which is streamlining the process there. Was there a question? Sorry.
No.
Oh, okay, great. I did want to also highlight the licensing portion. I did just pull numbers this afternoon, and we're at 92.5% completed with those inspections that we've been tracking for the licensing year. Licensing year ends June 30. Currently, we have 925 total facilities, so we went up by a number of facilities since last week. Those facilities are coming online with pre-inspections, and we're tracking just a little bit ahead for the year on those. So we're making good progress and just wanted to report out on those. Any questions?
So Julie, that is not just short-term rentals, that's everything.
That is not.
Hotel,
That is
motel.
everything.
Okay.
Yep, so that's hotel, motel, that is retail food, agricultural facilities, recreational water facilities, so think your pools, those are also licensed, and campgrounds. So that's everything. I will say a majority of our licenses here in Sawyer County are the short-term rentals. However, we have a disproportionate burden in comparison to some other agent programs with how many we have. I believe it's over 600 of those 925 are short-term rentals.
I think it was reported running around 600. And we'll see what happens with the new license when they're due June 30th, I think, to see if that number changes.
And it will change because some of the hotel motels are now under the new ATCP 72. They would be considered short-term rentals, depending on, factors like that they may have been in the hotel motel last year, but now they're in the tourist rooming house. So that will be modified because the tourist rooming house categories are now increased.
Has there been a lot of questions about the Sawyer County license that's in effect this year?
We have taken some questions, yes. A lot of those facilities, if you had 4 or under for tourist rooming houses, many of them came online last year. This is with this year and the new code that has expanded. So there, in a number of facilities, were in that category. So they weren't classified as tourist rooming houses before. So there has been education around that and to be in compliance with the new code for sure. So there has been questions and just trying to really do a good job when we're in the field to make sure we're educating on that and making sure we have good communication with our owners and operators.
Any questions? Thank you, Julie.
Thank you.
Fiscal. Budget performance.
I think I pulled out, we've already kind of recapped and talked through like where we're seeing some of the expenses that were unexpected, which was through those Chapter 55s. Have found out that one will be coming offline and moving into Inclusa. And then we're also billing and working with those guardians. So as they start to sell off property, being able to have them pay off those expenses that we had. So that's one of our big areas that we're really working in. Nothing too crazy has been happening in the YJ world. That's been, a lot more compares to other years, so very happy about that. Some of the changes that went into effect with the Mendota and the correctional facility that we would send them to, those costs were at, I think we were paying $1,600 a day. And then the recommendation was to go up to $2,500 a day, if you guys remember that. And then it got readjusted down to $520. We have 2 or 3 within that facility. So that has really helped us in our, what it would have normally cost. And we did always have somebody in those facilities. So that is helping us in our budgets this year. Otherwise, there hasn't been any big bills that have come through that were unexpected or out of our budget projections. And no big revenue drops either. I guess that would be the other thing to be looking at, is where we are losing revenue. We're actually making some of our grants go a little bit farther than we had expected to assist with some staffing costs. So I think we're in pretty good shape.
And you've started for 2027?
We just had a meeting today to be looking at, we have to do breakouts with staffing into the different areas. Randy's gotten us all the information, and Tanya has it almost all updated and moved into our spreadsheet. So now we did a lot, well, we've done a lot of work over the last 2 years. 2 years ago, Mike took and kind of redid a little bit how we had done it from the past. Last year, we really honed in, and it took us a long time to go line by line by line, make notes on what is in those categories so that we have really clear, crisp projections as we move forward, or as good as we can in anticipating those things. So I think we're in pretty good shape this year because of all the work that's been done over the last 2 years. It should make the budget process much better. I mean, you guys will just see the same big, a lot of information, but our side compiling it is going to feel a little bit better.
It's going to be big no matter what.
It's big no matter what. There's a lot of services that are needed within this community. I would say the one thing that we would just be most concerned about as we move forward is really kind of looking at public health and seeing where some of the drops are there. One of the benefits of being smaller is that some of those drops aren't impacting us as much as others because we piecemeal things together into like one person. So if you get a $7,000 drop in a program, it's not as big of a deal off of that one person versus somebody getting a $56,000 drop. And I mean, it eliminates a position. So there are advantages to being smaller than bigger when it comes to some of the way the cuts are happening right now.
Should we move on to purchase service and revenues recap? Is there anything that you need to highlight there?
No, I just kind of pulled some of those things that I had mentioned.
All right. So let's move on to number 18, board-appointed committee updates. Is there anything that anyone wants to share from another committee? Is there any correspondence or reports from conferences and meetings? You already gave your meeting report. Any future agenda items? We'll have the truancy and diversion for next month.
It'll stay on there.
Anything else?
And we'll bring back the bylaws again, because it sounds like those will be already looked at before, or that's happening this month, Mike?
Correct, yep.
Okay.
And the community services resolution, mobile support.
Thank you. I already forgot.
All right, our next meeting is the 2nd of July at 5 p.m. We're adjourned.
Thank you.